right, so we'll start with our first community lecture. We have it streaming on Zoom right now, but I'm also trying to do some multitasking and putting it on Instagram and YouTube. So, for those of you, if you are on Instagram or YouTube, you're not going to be able to see the slides, but you can log into our Zoom account and see those. So, I'll share my screen. If you are interested in getting the slides, feel free to shoot me a message, and I'm happy to get you the slides on our inflammation talk, the good and the bad, and how to um, prevent chronic inflammation, but also why inflammation might actually be good for us. So, first off, we're just going to do a quick kind of a sciencey talk, I guess, about what inflammation actually is. So, inflammation is a normal part of our body. It actually is a process that helps prevent infections, helps us heal wounds, and we're going to go into all that stuff. It occurs when there is an injury, or when we are sick, or when we have any sort of issues going on into our body. It's also going to help promote healing and it's supposed to help make us feel better. If it's prolonged inflammation, if it is something that's going on for a really long time without any tissue damage or invader signaling, that's when it becomes chronic inflammation, and that's when it's not good. So we'll go into some of that stuff as well. So so what actually happens during an injury? So we're just going to pretend that we're going to step on a nail for a second, which gives everyone kind of the heebie-jeebies. So you step on a nail, you feel the pain shoot into your foot, and your brain says, "Hey, do we need to get out of here, or is this okay?" Everyone has the same reaction. You step on the nail, the foot comes up really fast, and it hurts. So the brain then determines, do we need to run? Do we need to get out of there? Or is it safe? Is it okay to be painful? So it's one thing if you step on a nail, you have that painful response in the foot because you're in a safe environment. But if there's an issue where, let's say you're walking through the woods and a bear attacks you, and you have a lot of pain because that bear attacks, it's not safe for you to sit there and be like, oh, wow, my arm hurts because the bear just bit me. It's like, no, I need to get the hell out of there. So the body sends you more into a fight or flight response versus a parasympathetic response where you can start to heal. So that's the acute injury response. The secondary response is the brain signals, hey, we need to start releasing endorphins or painkillers. And then the immune system starts to respond to start to kill any sort of bacteria or any sort of um, bacteria or parasites or anything else that is infecting us. So we're going to go through again just some quick science stuff here first, and then we're going to talk about kind of what to do when this happens. So there's 4 phases of wound healing. So the first injury, so again, we step on that nail. The first thing we want to do is we don't want to bleed out, right? So the body sends some of it starts to what they call vasoconstrict, where the vascular structures start to constrict on themselves to decrease the blood flow to that area. And then our blood platelets and our blood platelets come to the area to start to what we call coagulate or stop some of the bleeding. And then we get some of the leukocyte migration. Again, we're going to go into some of these terms here in just a second, but that goes on, immediately from the injury up until several hours afterwards. Then we go through an inflammatory phase, which can last for a few hours or several days. Then we go through the proliferative phase where we start to get some healing and some restructuring of the damaged tissue, and then remodeling where it starts to put the finishing touches on there. So when we think about a injury response, we think of white blood cells. So our white blood cells are our immune system. There's 5 different types of white blood cells. There's neutrophils, which actually destroy the pathogen, destroy the invaders, and it's what helps keeps the bacteria and all the bad things from coming in. We have the lymphocytes, which are broken up into T cells and B cells. The T cells fight infection, and the B cells produce antibodies. Then we have monocytes, which are macrophages, which actually come and eat all the bad things and debris. Eosinophils are involved in allergic reactions, and it's going to fight parasites. And then we have the basophils, which are the cells that release histamine, so like our inflammatory response, and contribute to inflammation and anticoagulation. So Again, we go through the 4 stages of wound healing. You can see the different areas and different phases of wound healing and how the neutrophils, lymphocytes, monocytes, eosinophils, and basophils all kind of help with that process of healing. Again, I don't want to go too much into the weeds. I do want to try to keep this short and not over anyone's head, but just we need to find out some of the basics of wound healing in order to determine, what it is that we need to do for inflammation and how to fight that. So first off, is inflammation good? So inflammation gets a very bad rap in terms of it causes a lot of issues. So inflammatory bowel disease, chronic inflammation, all these things are very key terms right now that are kind of hot button terms, but inflammation gets a bad rap because we need inflammation again to help promote healing and to help promote some restructuring of our tissues. So the immune system is what again helps us heal, helps us fight off some of the bad things. So injuries, sickness, that sort of thing. So the immune system looks at a cell and says, "Is this me or not me?" If it's not me, then it tries to kill the cell. It's going to call for reinforcements or call the herd and bring in all the backups. And it's going to demolish and destroy the invading cells, bring in the builders to start the restructuring process, and then it's going to shut down that process once the tissue damage is healed, is complete. So we need inflammation as a cue for all of this stuff to happen. So if we didn't have an inflammatory response, we wouldn't have any of these, and we'd have a lot more illnesses, infections, and we wouldn't heal if we got hurt. So this is a big chart in terms of the cycle of what happens. So bacteria, virus, an injury, a stress cell occurs. And then that's going to signal cytokines, which are a cell that attracts the immune cells. So again, all the eosinophils, neutrophils, macrophages, and it also, or macrophage, excuse me, and it also signals what's called a mast cell. And a mast cell is what keeps the inflammation cycle going until the healing process and the rebuilding process is completed. So that mast cell then comes back around and signals to the cytokines, hey, we need more reinforcements. Keep sending the troops. We need to continue to clear out the damaged structures. So the cytokines continue to signal the white blood cells to keep coming to the area. And then those mast cells keep that cycle going. So the problem is when the tissue is healed, the bacteria, the virus is gone, but you still have continued inflammation. So before we get into some chronic inflammation, we want to talk about what do we do in an acute injury. So the old adage is that you want to put ice on the injury immediately. You want to rest. You want to put some compression on there, so a wrap, and you want to elevate. So there's been a lot of discussion in terms of is ice good or is it bad? Because again, we need some of that inflammatory process to take place for the healing, but ice is supposed to help reduce inflammation. So do we want to throw ice on an acute injury right away? And this is one of the studies that has come out in terms of kind of speaking against that a little bit. So the main I guess, discovery in this was in a sentence here, although clinicians have become cognizant of the many therapeutic interventions available for treating inflammation, the dogmatic approach commonly used has little scientific base in current literature. So this was a huge review, and it was talking about, again, our friends, the neutrophils and macrophages, and its role in inflammation. So do we want to throw ice on an area right away after the injury? The answer might not be right away. So the old adage was rice. So rest, ice, compression, elevate. Now people are starting to go more towards a different model than that. So protect, so it's police. So protect, optimal loading, ice, compress, elevate. And with the ice in this case, you're not using it for prolonged periods of time. You're using it for like 5 to 10 minutes at a time just to help more with pain modulation, not the inflammatory process. So if there's an area that has a lot of swelling, we don't necessarily want to just throw ice on there. What actually helps with some of the swelling are like massage techniques. There might be some lymphatic work, or even KT tape has been shown to help with flushing out some of that inflammatory process. That's actually better than ice. But we want to start loading some of the tissue as soon as we can, as soon as it's safe. So at first, you need to protect the area. So you don't want to overload the system, and you don't want to put it in a cast. You want to protect it. So if you sprain an ankle, you want to start to return to movement as quickly and as safely as you can. Now, if I were to break a bone, yeah, I need to cast the bone. I need to let it sit for a while. I need to let that bone form and regrow without continuing to fracture the bone. But if we're talking about tissue or muscle, we want to start to load that tissue. We want to start to load the muscle in a safe fashion. But that can come in many forms. So if say I hurt my bicep, I'm not going to start to resume bicep curls right away. I might start with just kind of lifting up lightly on my desk, let's say, just like an isometric hold where I start to get some of the muscle contraction in a pain-free fashion, but we just start to get a little bit of that muscle contraction just to start to load it. And then we can use ice afterwards. And if it starts to bother us, if it's painful after some of the loading, we can do that to then just help with pain modulation. And then we can do some compression, which also has a little bit of conflicting research behind it. Compression isn't always the best thing to help with inflammation. Like I said, some of that manual therapy, massage, lymphatic work, or KT tape can actually help flush the inflammation out much faster than just putting some compression on there. And then you do want to elevate to let gravity kind of help with that inflammatory process. So now we've talked about like some of the good inflammation. I want to go through bad inflammation. So what is it when there's bad inflammation? So in acute pain, we sprain our ankle. It occurs right away. We sprain our ankle. Ouch! It hurts. I can't put weight on my foot. There's a known cause. I turn my ankle stepping on a rock while I was hiking. That signal is a way for us to say, hey, there's something wrong. It's a warning sign that we don't want to ignore, but we don't want to just completely stop using our ankle, right? It can be easily diagnosed. There's a cause and effect, and the pain stops when the tissue's healed. When we think about chronic pain, however, we've had that injury, let's say, and I've gone, weeks, months, without really loading that tissue, and it still hurts. It still gives me pain signals every time I try to put weight into my foot. I've done imaging. There's nothing wrong with it. There's everything like the ligaments, the tendons, the muscle, the bone. There's no evidence of fracture. There's nothing there, but the pain still persists. So that's more of a chronic inflammatory or chronic pain state. There's pain in the absence of damage. So just because you have pain doesn't mean that there's tissue damage. The pain can't be consistently reproduced. So sometimes if I put weight on my foot, it hurts. Sometimes it doesn't. Sometimes if I turn my ankle in or out, it hurts. Sometimes it doesn't. So there's just some inconsistencies in the way that we can reproduce the symptoms. There's a change in the description of the pain. So sometimes it's sharp, sometimes it's dull, sometimes it aches. This occurs because the nervous system has become overstimulated, and it's like there's this spotlight from your brain that's just saying, hey, there's something wrong with this, even though there's not. And so that's where that chronic pain cycle comes into play. And there's some techniques you can do to try to get out of that pain cycle. It's also very difficult to locate where the pain has occurred. So again, if I sprain my ankle, I can point to a spot on my ankle and say, it hurts right here. But as that pain becomes more chronic, instead of a pinpoint pain, it becomes this, my whole ankle hurts, and I can't really point to one area that reproduces, or that's where my pain is. So that's another area or another thing with that we'll notice with a lot of chronic pain. So we've talked about like white blood cells. So our immune system, a lot of our immune system is located in our gut. And so a healthy GI system is a fantastic way to fight chronic inflammation and to help you heal better. So there are some characteristics that you can look at to say, hey, is my GI tract, is my immune system stressed? So I'll read through some of these. So you'll know your immune system and GI are stressed if you have a very delicate stomach. So you frequently have abdominal cramping, diarrhea after eating. Maybe you've had a lot of history of food poisoning, giardia, and you've taken a large amount of antibiotics in the past. You know your immune system is stressed when you frequently feel like you're getting sick, feeling tired, run down, fatigued. There's just a lot of just malaise, and you can't get up and get awake. You know your immune and GI system are overactive when you feel worse during times of high stress. So maybe your pain flares up if you get stressed out. If you have a lot of stiffness as well as pain, stiffness and tightness are signs of inflammation, and inflammation is caused by the immune system. You know your immune system is stressed if the pain is unpredictable and not consistently reproduced, like we talked about just a little bit ago. You'll know it's stressed when you see multiple areas of the body that hurt, even when they're touched very lightly. And then the other one is if you're stressed and you have pain in multiple areas and you have environmental allergies. So again, this your immune system is under attack from environmental allergies, and it can flare up some of your back pain or your ankle pain, that sort of thing. So these are all key signs that maybe your immune system or your gut aren't as healthy as they could be, which can then keep that chronic inflammatory cycle persisting. So we want to control gut inflammation in order to control chronic inflammation. So we're going to go through just a quick battle plan here of things you can do to help with your GI system and your gut. So we want to decrease inflammation in the GI tract. So first, we need to know what is irritating our GI system. So we can't just throw a bunch of solutions at a problem that we don't know what the problem is. So definitely you want to try to keep a food log and kind of, I guess, keep track of how, like, everything you eat and how you feel after you eat that, and note anything that causes some disruption or disturbance in the GI tract. You can get a food allergy or a sensitivity test. Heather and I got a LEAP MRT test at one point where they draw vials of blood and they look at how you respond to different foods. The only caveat with these is that it does change. So if you go anywhere between 4 to 6 months without eating a certain food, your allergy may decrease or your gut will continue to change because it continues to remodel itself. So you can do these sensitivity tests if you're having just a lot of chronic pain to see what you're currently reactive to, but that may change within a few months of eating differently. And then once we've figured out some of our GI issues, then we want to start to eliminate foods. So the most common type of foods that people are really sensitive to are corn or corn syrups, which are in pretty much every sort of processed or boxed food. A lot of people are sensitive to eggs, dairy, soy. Sugar is a huge one. Wheat, yeast, and mold. So I didn't go too much into sugar, but I do want to touch base on this because the sugar is one of those things that is in everything, and they have like 50 to 70 some odd different names for sugar. So you really want to take the time to look at the ingredients and make sure that you're eating very cleanly with that, because sugar has been shown in research when they compared sugar to cocaine and its ability to light up our pleasure centers in our brain. It's been shown that sugar actually lights up our pleasure centers in our brain more than cocaine. So you have to make sure, like, it can be very addictive to have sugar, but getting away from that constant sugar is a great way to start to reduce inflammation, but it can be very tough. So some of the other battle plans are we want to start to make our tummy happy. So aloe vera juice is a great way to help relieve inflammation in the GI tract. So if you are allergic to garlic or onion, you may also be allergic to aloe, but it's a great way to start to calm that inflammation in your gut. Research shows about 2 ounces of aloe vera juice per day can really help calm everything down. The other thing is probiotics. How much is a common question that we get, but it's very hard to say. So you kind of have to do a trial and error. So they'll do, let's say there's a probiotic. If you're taking a straight probiotic, they might call it a probiotic one. That means there's 1 billion probiotic molecule, let's say, that are in there that interact. If it's probiotic 2, then there's 2 billion, and so on and so forth. So sometimes if you throw too much of the probiotic in at once, you can have like a bad reaction to that. So you want to make sure that you start with a lower number and steadily increase that. Yogurt has also been a an advertised or marketed way to get good probiotics. However, you want to make sure that they're not this like overload of probiotics, because again, too much of a good thing can be bad. So unless you know how much it is, and unless it tells you what the CFUs are, or those that probiotic 1, probiotic 2, you want to avoid those super enriched probiotic yogurts because they can actually be an irritant, and especially if they are flavored with any sort of flavoring and have added sugars in there. Again, that's defeating the purpose of the probiotic. It's just going to go through and irritate that gut again. The other thing that we found works really well is using castor oil pack, which my wife bought one through a website called the Queen of Thrones. And you put the castor oil on the pack and you sleep with it, and it can actually help kind of calm down some of the inflammation in the gut. So we really recommend some of that stuff if you are having a lot of issues gut wise there. The other thing is we want to eat some anti-inflammatory. So we're going to talk about omega-3s and omega-6s here for a while. Omega-6s are necessary in our diet. They're pro-inflammatory and they're needed to help fight infections. We get these from whole grain breads, cereals, wheat, baked goods, corn oil, peanuts, sunflower oil. You can see the list there. There's also a lot in meat now because of the amount of corn and wheat that we feed our cows and pigs and everything. So they've actually had a spike in omega-6 concentration. And we're going to go into that a little bit here in just a second of why that might be bad and how we can actually eat around that. Omega-3s are an anti-inflammatory omega. So we're looking at flaxseed, walnuts, salmon, sardines, halibut, herring, cauliflower, broccoli, Brussels sprouts, cod, snapper, and tuna. And again, you want to have these fresh caught, wild caught, wild, pasture raised. Everything with the quality makes a big difference. You can get some omegas in free range chicken and free range pork, but not as much with the beef. Rosemary, and then cooking with rosemary and oregano can actually help preserve omega-3s while cooking because they don't respond well to heat. The ideal ratio between omega-6 to omega-3 is around 4 to 1. Some experts will say it's 1 to 1. Typical American diet, if you can look at all the foods that are in omega-6s or that have omega-6s and all the foods that have omega-3s, you can probably guess that we are way out of proportion in terms of the amount of omega-6s to amount of omega-3s that we eat. So the typical American diet is about 30 to 1 when it should be about 4 to 1. So meat quality makes a huge difference. So grass-fed meat and wild-caught fish are more expensive, but they make a huge difference in terms of the amount of omega-6s that are in there. And the amount of omega-3s in terms of the fish. So again, omega-3s, salmon, sardines, we want those wild caught. When we look at some of the meat that we eat, they are pumped with antibiotics to help them grow faster. They're pumped with hormones. So when we look at the lifestyle or the feeding style of cattle, cattle are fed antibiotics because their system is not designed to digest corn. They have a high corn, a high wheat diet. So they're given antibiotics to help fight some of the E. coli infections. Research has shown when we change a cow's diet from these corn-fed, wheat-fed diets to more of a grass-fed diet, within 2 days, the E. coli level drops to a normal level. So we could actually eliminate the need for antibiotics for E. coli if they were just fed more of a grass-fed diet. The reason they do this is because it makes it cheaper to feed them. They grow faster, they grow bigger, so the harvest is a lot bigger. But in terms of quality, it really starts to increase the amount of omega-6s that we eat when we eat red meat because of all these hormones and because of all the corn and wheat that they're fed. So how do we get more omega-3s in our diet? So Fish oil supplements are great. You want to get a cold pressed supplement because, again, heat kills omega 3s. Heat, light, and oxygen actually destroy omega 3. So you want to make sure that they're stored in a cool, dark place, but you don't want them refrigerated. Um, Sometimes you'll buy a fish oil capsule and it's actually already gone bad. So if you are taking a fish oil capsule and you burp fish or you taste fish, it's rancid. You need to throw it out. It should not it should not cause burping of fish. It should not taste like fish. It should be tasteless. So if you are tasting that, you need to throw those capsules out and buy new ones. So ideally, you'll buy them in smaller quantities, so that way you have a less of a chance of them going bad. One brand that we found has a good ratio is Nordic Naturals, which you can buy on Amazon, just like you can buy anything these days. When you're looking at fish oil supplements, though, you do want to make sure that you're getting 200 milligrams of EPA plus DHA, not just 1,200 milligrams of fish oil. So you want to make sure you're looking at the label and looking at the EPA plus DHA should be about 1,200, and that's your serving for omegas. The next part of the battle plan is we want to improve our cellular health. So antioxidants are great for that. So free radicals are a thing that damage cells. They damage the cell membrane because they're an unstable electron or an unstable molecule coming through, and they need to steal the electrons from the cell membrane. So they're caused by metabolism, immune cells, damaged cells, exposure to pollution, radiation, cigarette smoke, herbicides, pesticides. All these create free radicals in our system. So free radicals are created from oxidation. So we need to include antioxidants to help fight that oxidation. Foods high in antioxidants are red delicious apples, pears, avocados, orange, grapes, bananas, blueberries, concentrated cherry juice, broccoli, strawberries, just to name a few. But all these teas and everything with antioxidants are great to start to level out some of the oxidation levels in our body and protect some of our cellular health. A big one that we talk about with a lot of people in our practice is tart cherry juice concentrate. Cherries are packed with a lot of antioxidants and a lot of anti-inflammatory substance, including anthocyanin and quercetin, excuse me. The anthocyanin is a great way it actually helps lower our urate or uric acid in the bloodstream. So if you have gout, drinking some of the tart cherry juice can help with gout. It acts as an anti-inflammatory around the same levels of what NSAIDs do. It can suppress the production of pro-inflammatory cytokines, and it protects the cell membranes. The quercetin is an antioxidant and a natural antihistamine, and it also has melatonin in it, which melatonin is an antioxidant, anti-inflammatory hormone, absorbs free radicals, protects cell membranes, protects our DNA. And so this tart cherry juice is a great way to help balance out some of the cellular health. And the great thing is that because it has melatonin, because it helps stimulate the melatonin release, it's a great way to help you fall asleep and stay asleep. So they recommend about 2 tablespoons. And I usually say about 30 to 45 minutes before bed because it can help you fall asleep. Now, we'll get tart cherry juice concentrate. You can get it at like a Sprouts or Whole Foods. Lakewood brand is the one that we get at Sprouts, and it does a great job. It's a pretty clean product, I think. Next thing we want to do is improve our brain. So if we're in pain for a long period of time, movements where we start to think about the movement can cause pain. So no brain, no pain. So if there's no brain to interpret the signals, so we don't have pain receptors in our body. We have nerves that send signals to our brain, and our brain interprets it as a threat or not threat. And so if it's a threat, it's going to say, "Hey, that's painful. It's a warning sign. You need to get away." So we have to, if we're in a lot of chronic pain, we have to do some work with our brain. When we're in chronic pain, we'll produce a lot of adrenaline. So one way to help with adrenaline decrease is aerobic exercise. 20 to 40 minutes of moderate intensity exercise per day can actually help reduce the amount of adrenaline that we have in our bodies. And so If you're unable to tolerate 40 minutes, maybe you start a couple times a day at 10 minutes and you start to build up from there. That adrenaline is what keeps us in that fight or flight and keeps us from being able to heal and recover and relax. And it can also help improve sleep quality as well with the aerobic exercise. Positive self-talk, saying, hey, I can do this. It doesn't hurt. Sleeping, sleep, sleep, sleep. We have to sleep better to help heal and recover. And then we can also do some physical movements or what we call a graded return to movement. An example of a graded return to movement, let's say I have pain when I go into a forward bend. Sometimes if you're in pain for a long period of time and I think about forward bending, it can cause pain. So the first thing we want to do is just go through a mental exercise of picturing yourself going into a forward bend and saying, okay, I'm not actually doing this. It doesn't hurt. I can do this. The next thing you can start is in a forward bend, you can just start with a chin tuck. And then you can progress to pulling one knee to your chest when you're laying on your back. Then you can do knee to chest with a chin tuck, laying on your back. Then you can go on your back, both knees to your chest, both knees to your chest with a chin tuck. And then we can switch to more of a weight bearing position where we go hands and knees and we rock back in a pain-free movement. Then we can go hands and knees rocking all the way back into a child's pose. Then we can progress to a seated forward bend with our knees bent. Then we can straighten our legs out in a long sitting assisted curl up, a long sitting curl up, a seated forward bend with knees straight, and then finally we get into a forward bend. So we've gone through all these movements and we're slowly increasing the demand on our body just to show like, hey, we can do this, or it also helps it also helps prepare our body to go through the movement. So we start to load the system in a non-threatening way. So that's our rapid talk on inflammation and how you can, I guess, treat the body and treat your gut to help with some of those chronic inflammation, but also give you some information in terms of what to do during an acute injury. At this time, if there are any questions, I'd love to open it up to any sort of questions if there are some. I'm gonna unshare my screen here. If there are no questions, we are gonna try to make this a monthly um, a monthly thing that we start to do some community lectures just to kind of give back to the community and give people some free resources on what to do. Next month, we're going to be talking about core strength. So what your core is and how to maximize your stability and what your core actually does. There's a lot of buzzwords around core stability when it comes to back pain. And so hopefully we can set some of those straight, but also give you some information on how to maximize your core strength. We're always open to any and all questions and or recommendations in terms of I want you to talk about XYZ. So if there are questions on things that you've been wondering and you want us to do a community lecture on, feel free to send us that question. Karen, how you doing? How do cortisone shots affect inflammation? So cortisone injections are they help kind of break that inflammatory cycle. So when you're in that chronic inflammatory state where we talked about those mast cells that continue to churn, they continue to signal the body, hey, you need to inflame, you need to inflame, you need to inflame. There's still tissue damage. What that does is it actually helps calm that process down. So when long ago, before I started at Barrow, I used to think that cortisone injections were just kind of a band-aid that you put on, and they don't really do anything. But after working there for a while and seeing a lot of people that have gone through that, I do think there is some value in the cortisone injections kind of breaking that inflammatory process. But you have to pair that with some sort of rehab. So if let's say you have a lot of back pain, cortisone injection knocks that back pain down. It's been a chronic low back pain, and now you're moving better. If you say, hey, I'm moving well, and just take that and run and don't do anything to correct the problem, then odds are it could come back. So what you want to do is use when you're feeling good with the cortisone injection is use that time to really start to determine, hey, what caused my pain initially, and start to do some rehabilitation with that. Now, if you're in that chronic pain cycle and that this inflammatory cycle continues to persist, sometimes just breaking that cycle with the cortisone injection can actually help you help everything just calm down. And so you might have already had the tissue healing taken place. You might be out of pain, and all it was just this rogue signal that continued to churn. So that's where some people can actually get better just with the cortisone injection, but we always recommend doing something along with the injection just to help improve your mobility, and try to help prevent that problem from coming back. Because a lot of times we'll see, let's say my low back hurts. I have degeneration at L4, L5. um, our body tends to move through areas of least resistance. So if I have a lot of damage at L4, L5, let's say, that might be because that was the place where my body found the easiest amount of movement. So a lot of times we'll look above that. So how well does the thoracic spine move? How well do all the joints above L4, L5 move? We'll look below. So how well does L5, S1 move? How well does the SI move? How well does the pelvis move? So we try to improve mobility around those areas that are painful. So that way, when we do start to go back to movement, now we're getting movement from our thoracic spine. We're getting movement from the rest of our lumbar vertebrae. And it's not just going back to moving from L4, L5. So those cortisone shots can really help decrease the pain while we improve some of the other areas. Long-winded, but hopefully that helps. Okay. If you guys have any other questions or anything, feel free to shoot me an email at greg@lawsofmotionpt.com, or visit our website, and you can schedule a free 15-minute discovery call with us at lawsofmotionpt.com. Always happy to chat and email back and forth if you guys have questions. But we're here to help you guys. So hopefully I'll try to get the invitations out for the next lecture series here shortly about core. But again, if you guys have any other requests in terms of what you want to hear us talk about, we'd be happy to do that. So any other questions from the gallery? Awesome. Oh, wait, there we go. Awesome. So thanks for coming by. Appreciate it. And hopefully we'll see you next month for the core strengthening, core stability lecture. Thanks, guys.